We are now at a turning point for mental health across Europe. Rates of mental illness have been increasing in recent years for young people. Awareness of mental health problems has never been higher, but the provision of care nowhere meets needs. These 4 landmark papers highlight this gap in care and shine the spotlight on 3 particular areas of concern: the mental health of children and young people, the situation in post-Soviet countries, and the mental health of healthcare workers.
There are unfortunately diminishing numbers of healthcare workers and they're getting older, and we know there's increased patient demand and also patient safety is increasingly important. We did a review looking at papers published between 2010 and 2024 looking at mental health, and we found that unfortunately most of them didn't look at formal mental health disorders like depression or PTSD. They looked at measures of things such as distress and burnout. Overall, we found that organisational factors were the most important, such as excessive workload, insufficient staffing, and perceived poor leadership and support. And staff who reported having more supportive leaders, good peer support, have better mental health. Nurses and people in ethnic minorities were disproportionately affected because of things such as racism, bullying and violence. And we found that the most impactful interventions were one that aimed to make a difference organisationally, so improving all leadership and peer support. And we found that individual level interventions weren't quite as important. Overall, there was lots that could be done to improve the quality of evidence, and healthcare organisations should pay attention to mental health and look mainly at organisational level interventions.
Child mental health disorders are very common, very disabling, but also very treatable. In the last few years, we've seen an increase in the number of referrals to the child and adolescent mental health services in the WHO European region. We attribute it to several reasons, in particular COVID-19 pandemic, military conflicts, but also change of interaction between the children and the digital technology. In our paper, we highlight 3 main strategies to address this growing need. Firstly, increase in the community mental health services, in particular intensive community mental health services, as an alternative to inpatient admissions. Secondly, embracing digital technology in both the treatment and prevention spaces through co-design and co-development together with the family members, but also service users. And thirdly, implementation of the culture of quality assurance and control throughout the WHO European region. All of this have to be underpinned by the robust research strategies and implementation of evidence-based interventions.
We analyzed mental health care systems in Central and Eastern Europe, collaborating in a large network of experts representing 19 countries of the region. The population there faces some unprecedented mental health challenges. Some of those are global, such as transition of humanity to digital space or climate change. But some of those are local, such as high rates of suicides, high rates of alcohol use disorder, the legacy of communist system, which still influences mental health care all over the region, or the war in Ukraine. Mental health care systems remain fragmented and non-evidence-based. Mental health policies and plans that have been introduced all over the region remain mostly on paper. Yet there are some bright spots. Public interest in mental health has risen over last years, and there are examples or high-quality services in the field of suicide prevention, perinatal mental health care, and others. The way forward is clear. We need to strengthen cooperation across health, education, and social sectors. We need to invest more into mental health care, and we need to develop systems of prevention, promotion, early detection, and early intervention. With coordinated action, we can build systems of mental health care that are strong and can serve the needs of the population.
We investigated mental health service coverage and treatment gaps across Europe. Through a systematic review, we identified 45 studies, providing almost 200 estimates of service coverage for mental health disorders at national or regional level. Our analysis revealed significant variations between countries and conditions. We found little reliable comparable data. Many countries lack national estimates, and the methodology used to calculate coverage vary widely, with longitudinal data being particularly limited. As a consequence, it is hard to compare coverage between countries, identify trend over times, and evaluate effectiveness of mental health policies. The data showed that coverage was generally higher for severe mental disorders, such as psychotic disorders, than for common conditions, such as depression, anxiety, or substance use disorders. Notably, marginalized populations, such as refugees, homeless people, and other minorities, experience disproportionately large treatment gaps, which further widens health inequities. Overall, our findings highlight the urgent need for harmonized monitoring systems across Europe. Consistent data is essential for countries to track their progress towards the WHO 2030 target of increasing mental health care coverage by 50%, and to ensure that mental health care is accessible, adequate, equitable across Europe.
These summaries have only covered a fraction of the content of these 4 superb reviews. We want the papers to provide a state-of-the-art summaries to support governments, civil society, people with lived experience and health service staff to redouble our efforts to strengthen mental health systems and services. In closing, I'd like to thank all the authors of the papers and the staff at the journal for producing the series. Thank you for watching this video on transforming mental health in Europe.